All right, so lately every time I scroll through the news or social media, there's another headline about some scary new virus going around,
Hmm.
especially those pictures coming out of China. Yikes. But the truth is, this so-called mystery virus isn't really a mystery anymore. We know it as HMPV, or human metapneumovirus. And today we're going to dive deep into what HMPV actually is, what's going on with the recent uptick in cases, and whether or not those masks we all stashed away need to make a comeback. This is particularly relevant for you, given your parents are in their 80s and you're planning to visit them soon.
It's definitely a good time to be informed, especially when it comes to protecting loved ones who might be more vulnerable.
Okay, so first things first, HMPV. I'll admit I hadn't heard of it before all this buzz started.
Yeah.
So break it down for us. What exactly is it and how worried should we be?
Well, despite the recent headlines, HMTV is actually incredibly common. Think back to when you were a kid. Chances are you probably had it at some point. Most people have been infected with it by the time they're 5 years old.
Really? So it's not some brand new superbug?
No, not at all. It's been around for a while, and it typically causes mild cold-like symptoms.
Okay, so that's reassuring. But I'm still seeing reports of a spike in cases, especially in the UK. What's the deal with that? Is it actually worse than usual, or is this just typical for this time of year?
You've hit on a key point. There's been an increase in HMPV activity in the UK recently. The latest data from the UK Health Security Agency shows a positivity rate of 4.9%, which is pretty standard for this time of year. However, what's interesting is that when they broke down the data from those 7,826 respiratory samples, they analyzed the highest positivity rate. 7.3% was found in individuals aged 80 and older.
Wait, back up a second. 7,826 samples. How do they even collect that much data?
Well, it comes from various sources like hospitals, GP surgeries, and community testing programs. These samples are then analyzed using a technique called PCR, which is very sensitive and can detect even small amounts of the virus.
Wow, that's fascinating. I guess I never really thought about all the work that goes into tracking these viruses behind the scenes. So are we essentially seeing a peak in cases because it's winter, just like with the flu? Or is there something more to it this year?
That's the million-dollar question, isn't it? It's likely a combination of factors. The seasonal pattern is definitely at play. But after a couple of years of COVID precautions like masking and social distancing, we might be seeing a bit of a rebound effect as those measures have relaxed. Think of it like the virus is playing catch-up.
So potentially more people are susceptible now. Okay, that makes sense. But then why are some experts suggesting we mask up again? Isn't that a bit extreme if it's basically just a common cold for most people?
You're right that for most healthy adults, HMPV is not usually a major concern. However, for certain groups, older adults like your parents, young children, and those with compromised immune systems, it can pose a more serious risk, leading to complications like bronchitis or pneumonia. And remember, it spreads through respiratory droplets, just like the flu and COVID.
So those same precautions we've all gotten used to, hand washing, covering coughs, staying home when sick, those still apply here.
Absolutely. Those are always your first line of defense. The suggestion to consider wearing a mask, particularly in crowded indoor spaces, is really about adding an extra layer of protection for those who are more vulnerable, like your parents.
So it's not about everyone masking up all the time again, more like a targeted approach.
Exactly. It's about being mindful of the potential risks and making informed decisions based on your own individual circumstances and the people you'll be interacting with.
That makes a lot of sense. So while we're on the topic of varying risks, what about all those alarming pictures we're seeing from China? It seems like HMPV is hitting kids especially hard over there, with hospitals overwhelmed. It's giving everyone some serious COVID flashbacks.
I can understand why those images would cause concern, but it's important to remember that there are a lot of factors at play in China, and we can't necessarily draw a direct comparison to the UK. For instance, the dominant strain of HMPV circulating there might be different, and their healthcare system operates under a different set of pressures.
So we shouldn't assume the same thing is going to happen here.
Not necessarily. While we can learn from their experience, it's important to avoid jumping to conclusions based on limited information.
All right, that's reassuring.
Yeah.
So we've established that HMPV is common, usually mild, but can be riskier for certain groups. We've talked about those basic precautions and the possibility of masking up in specific situations. But I have to ask, if HMPV is so widespread, why are we seeing this uptick now? Is it just the usual winter surge, the post-COVID catch-up effect you mentioned, or could there be something else going on?
Well, what's fascinating here is that scientists are actually exploring the possibility of a new strain of HMPV circulating. They're looking at whether this new strain might be more transmissible or causing more severe illness, particularly in certain age groups.
Hold on, a new strain. Now that does sound a bit more worrisome. Tell me more about that.
It's definitely something scientists are keeping a close eye on. Viruses are constantly evolving and new strains emerge all the time. This particular strain they're investigating seems to have some unique mutations in its genetic code, which could potentially be affecting its behavior.
So are these mutations making it spread more easily or causing it to be more severe?
That's what they're trying to determine. Early research suggests that this new strain might be more efficient at binding to human cells, which could explain why it seems to be affecting younger children more severely in some parts of the world. But more research is needed to confirm these initial findings.
Okay, so there's still a lot we don't know yet. But this all ties back to the data you mentioned earlier. I mean, analyzing over 7,000 samples just for HMPV, that's a lot of data. What other insights are they gleaning from all this information?
That's a great question. One of the things they're looking at is how immunity plays a role in the spread and severity of HMPV. Remember how we talked about most people having had it by age 5? Well, that previous exposure usually provides some level of protection. However, immunity can wane over time, and that's especially true for older adults.
Ah, so that could be why we're seeing higher positivity rates in the 80-plus age group. Their immunity might not be as robust as it used to be.
Exactly. And that's why it's crucial to consider things like booster shots for vulnerable populations, similar to what we do for the flu. But it's not just about individual immunity, it's also about population immunity. If a large portion of the population is immune, it creates a phenomenon called herd immunity, which helps to slow down the spread of the virus and protect those who are more susceptible.
Right, so it's about protecting everyone, not just ourselves.
Yeah.
That's something we've all learned from COVID.
Absolutely. And it highlights why public health measures like vaccination campaigns and targeted prevention strategies are so important in controlling the spread of these respiratory viruses.
So bringing it back to you and your upcoming trip to see your parents, what does all this mean for you practically? Should you be changing your plans, packing extra hand sanitizer, maybe even digging up those masks we talked about earlier?
Well, I think the key takeaway here is that HMPV is circulating, and it's something to be mindful of, especially when you're traveling and potentially exposed to more people. And since your parents are in the age group that's showing higher positivity rates, it's definitely wise to take some extra precautions.
Okay, so what does that look like? Give us the rundown.
Well, first and foremost, those everyday preventative measures we discussed are crucial. Make sure you're washing your hands frequently, especially after being in public spaces. If you can't wash your hands, hand sanitizer is a good backup. And remember to cover your coughs and sneezes. It seems basic, but it really does help to prevent the spread of those respiratory droplets.
Right, common sense stuff.
Yeah.
But what about masks? You mentioned earlier that they could be helpful in certain situations. Would this qualify?
I think it's worth considering, especially when you're traveling. Airports and airplanes can be breeding grounds for germs, and wearing a mask can provide an extra layer of protection for both you and the people around you. It's not about being paranoid, just being proactive and reducing the risk.
Okay, that makes sense. And what about once I get to my parents' house? Should we all be masked up indoors?
It's a conversation worth having with them. If they're comfortable with it, wearing masks in close quarters, especially during the first few days of your visit, could provide additional peace of mind.
And it never hurts to be extra cautious, right?
Exactly. And beyond masks, think about things like ventilation. Opening windows for a few minutes each day to circulate fresh air can also help to reduce the concentration of viral particles indoors.
Okay, so that's ventilation, hand washing masks.
Yeah.
Got it. Anything else?
Well, this might go without saying, but if you start to feel any symptoms at all, it's crucial to stay home and avoid contact with your parents. Even if it ends up being a regular cold, it's better to be safe than sorry.
That's great advice. And honestly, it's a good reminder that even though we're past the peak of the COVID pandemic, we still need to be vigilant about these respiratory viruses. But I have to ask, considering all the factors we've talked about, seasonality, waning immunity, the possibility of this new strain, could the UK be headed for an HMPV surge similar to what we're seeing in China?
That's the big question everyone is asking, and it's honestly difficult to predict with certainty. There are so many variables at play, from the specific characteristics of this new strain to the overall health and immunity levels of the population.
Okay, so no crystal ball.
Yeah.
But what are the experts saying? What signs should we be looking for to gauge the potential for a surge here?
Well, one of the key indicators they're tracking is the rate of hospitalizations, specifically related to HMPV. If we start to see a significant increase in the number of people being admitted to hospitals with severe respiratory illness, that could be a red flag.
Okay, so Keeping an eye on hospital capacity makes sense. What about those 7,826 samples? Are they giving us any clues about the direction things might be heading in?
What's interesting is they're not just looking at the overall number of positive cases, but also the genetic makeup of the virus samples they're collecting. By analyzing the viral genomes, they can identify different strains and track how they're spreading throughout the population.
So it's like detective work. But for viruses, that's pretty cool. What are they hoping to find out from this genomic surveillance?
They're looking for patterns and trends that could help us understand how the virus is evolving and how it might impact different populations. For example, if they notice a particular strain becoming more prevalent or causing more severe disease, that could inform public health interventions.
That's fascinating. It really shows how much goes on behind the scenes to protect public health. So it's not just about treating the sick, but also about staying ahead of the curve and preventing outbreaks whenever possible.
Absolutely, and that's why this deep dive into HMPV is so important. The more we understand about the virus, the better equipped we'll be to make informed decisions for ourselves and our loved ones.
Right? Knowledge is power, as they say. So as we wrap up, I think the big takeaway for you is to be aware of HMPV. Practice those smart precautions and don't panic. It's a common virus, but understanding its nuances can help us navigate this evolving situation.
Exactly. Enjoy that visit with your parents. And remember, if you have any concerns, don't hesitate to reach out to your healthcare provider. They're your best resource for personalized advice.
Great advice. So to everyone listening, stay curious, stay informed, and stay healthy. We'll be back soon with another deep dive into a fascinating topic. Until then, keep those brains buzzing.